Assalamualaikum warahmatullahi wabarakatuh. I bid to Associate Professor Dr. Firdaus, our instructor for this assignment. We are from Group 3. Our group members include me, Nur Adilia Izzati, Wan Nur Baiti, Nur Fatini, Muhammad Hazim, Sharifah Rahimah, Nur and Nur Raihan. Today we'll be presenting our findings for the case that has been given to us. The question was, a patient who is 70 years old has multiple ocular issues. He has been using many drugs for his condition and came to your practice for a checkup with all his medication in his bag. Based on these, discuss the following. We were also recommended to build a table. Okay, so based on the drugs given, we have divided them into 3 groups based on what type of disease it aims to treat, which are anti-glaucoma, anti-infectives, and anti-inflammatory. For each drug, we needed to find what are the active ingredients, what the drugs do, how it is administered, the usual dosage, the side effects of taking them, the goal of treatment, and also what are other brands available for the same drug. Now, I'll pass it to Fatini to discuss drug A.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Fatini. So, for the first drug that the patient brought into the clinic is the tropicamide, which is manufactured by Sandoz. And the tropicamide works as a psychoplegic agent. The purpose of tropicamide is to relax cerebral muscle and iris sphincter muscle spasm, and also to prevent any posterior syndicate which could induce angle closure glaucoma. So the active ingredient in this Sandoz tropicamide is the tropicamide itself, and the administration is upon topical drop instillation through the eye, and usual dosage is 1 drop for every 6 hours. So for the other brand drug, there are a lot of side effects, both including which is commonly used as well. Is so, for example, it might increase eye opening for some patient, and Somerset Pharma, Madrasil, manufactured by Alcon. As for systemic, it might cause headache, dry mouth, and Ocutropic. So the goal of using tropicamide is so for the other brand of tropicamide, which is commonly used.
Assalamualaikum warahmatullahi wabarakatuh. My name is Wan Nur Baiti and I will continue this presentation on Forte prednisolone acetate 1%. As the name of this drug, the active ingredients for Forte is prednisolone. Prednisolone is a drug that belongs to a group of medicine called corticosteroid. The purpose of prednisolone is an effective anti-inflammatory agent in patients with external and intraocular inflammation. It will help to reduce the inflammation in our body or suppress the immune system. Inflammation can affect any parts of our body. Some of the symptoms of inflammations are swelling, redness, pain, and itching. Prednisolone works by entering the cells that causes inflammation and block the body's inflammatory reaction. It reduces the symptom of some condition, but it doesn't cure them. The administration for Forte is topical drop instillation with suspension and solution formulation. But some prednisolone do have oral administration where the prednisolone is available in tablet form. The common dosage for prednisolone are 2 drops every hour for 1 to 2 days, and if the symptoms reduces, we will reduce the dosage for 1 to 2 drops for 2 to 4 times daily. As prednisolone helps most people who take it, but some people do experience the side effects from prednisolone. Common side effects with high dosage for long periods of prednisolone are fluid retention, including bloating of the face and swelling of the abdomen, which sometimes results in weight gain. Skin thinning also occurs in some individuals, which causes them to bruise easily. Some also will experience irregular periods and muscle cramps. The psychological side effects of prednisolone are trouble in sleeping. The goals of treatments for prednisolone are reduce inflammation, as I said before, and block the inflammatory reaction of our body. The other brands of prednisolone that is available in the industry are prednisolone forte, which is from Allergan, and Minim's prednisolone, which is from Bosch and Long.
Assalamualaikum warahmatullahi wabarakatuh. My name is Adelia. Now for drug C, which falls under topical steroid, which is dexamethasone, or more known as Maxidex eye drop, which falls under the brand name Alken. The active ingredients is dexamethasone sodium phosphate, which is an anti-inflammatory and acts to reduce inflammation, alleviate symptoms, and promotes healing in ocular diseases such as in uveitis. It can be administered by the patient himself via topical drop installation, and the usual dosage are 1 to 2 drops every 4 to 6 hours until the symptoms are relieved. The side effects of taking this drug includes temporary sting or burning upon application, blurred vision, increase in intraocular pressure when prolonged use, delayed wound healing, and also increased risk of eye infection when prolonged use. The goal is that by giving this corticosteroid, it suppresses inflammatory response by inhibiting the release of inflammatory mediators such as histamines and prostaglandins, therefore reducing swelling, redness, and discomfort. Other brands for this drug includes Dexafree, Erythong, and also Dropodex.
Next, I will continue on Megabrom with active ingredient bromphenic. It is a non-steroid anti-inflammatory drug that reduces inflammation by inhibiting the activity of cyclooxygenase enzyme or COX enzyme, specifically COX-1 and COX-2. COX enzymes are responsible for the conversion of arachidonic acid into prostaglandins, and we know that prostaglandins plays an important role in the process of inflammation. It is usually administered topically, and usually 1 drop in the affected eye for 1 to 2 times daily. Begin 24 hours after cataract surgery and continue through the first 2 weeks of post-operative period. Common side effect includes eye pain, irritation, redness, headache, blurred vision, and photophobia. Severe side effect, though rare, may include severe eye pain, changes in vision, signs of allergic reaction like itching, swelling, rash, severe dizziness, and trouble breathing. The primary goal of the treatment is to treat post-operative inflammation and to reduce pain in patients who have undergone cataract surgery. Other brands of bromphenic ophthalmic solution could be Prolensa, Bromsite, and Yalox.
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Hazim Aiman and my metric number is 2217111. So I'm going to discuss one of the drugs that this patient used to treat this condition, which is Combigan. Combigan is an ophthalmic solution and it is one of the anti-glaucoma drugs. Combigan contains 2 active ingredients, which is brimonidine citrate 0.2% and temololimide 0.5%. So brimonidine citrate 0.2% is an alpha-2 adrenergic receptor agonist, which means it reduces intraocular pressure by enhancing uvoscleral outflow and reducing aqueous humor formation. Meanwhile, temololimide 0.5% is a non-selective beta-adrenergic receptor blocker that works to reduce intraocular pressure by decreasing aqueous humor production. And of course, Combigan is an anti-glaucoma drug, so it is used to treat chronic glaucoma and ocular hypertension. So it is used to lower the IOP in this patient. How is Combigan administered? Firstly, patient needs to wash hands with soap and water to avoid contamination and shake the bottle gently before use. If patient wear contact lenses, remove them before applying the drops. Contact lenses can usually be reinserted 15 minutes after using the medication. Then, the examiner give some instruction on a proper administration technique to the patient, including avoiding contamination of the dropper tip. Tilt the patient head and pull the lower eyelid downwards to create a small pocket for the drops, and with caution, instill the drops in the space and being careful not to touch the dropper tip to the patient eye, eyelid or any other surface to avoid contamination. Ask patient to put the finger and press gently at the punctum for a while after administration. This is because more medication can stay in the eye, so it can maximize the effectiveness and potentially reducing systemic side effect. Lastly, if any medication spills out of the patient eye, wipe it away with a clean tissue. The standard usual dosage for patients to do is 1 drop is instilled in the affected eye twice daily, approximately 12 hours apart, and Combigan should not be used in children under 2 years old. By using Combigan, there are many side effects that can be happen on ocular and systemic. For ocular side effect, it may include eye irritation, redness, discomfort, blurred vision, dry eyes, burning or stinging sensation, itching, and foreign body sensation. Meanwhile, for systemic side effect, it may include fatigue, headache, allergy reaction, cardiovascular effects such as bradycardia, hypotension, and respiratory issues such as bronchospasm. Thus, the primary goals of the Combigan treatment is to lower elevated IOP in patients with open-angle glaucoma or ocular hypertension in order to prevent vision loss and blindness and to prevent or slow the progression of glaucoma. The other example brands that contain brimonidine tetrate or temololumab alone include Alphagan P, which is brimonidine tetrate, Betaptip, which is temololumab, as well as Timoptip. Combigan combines these two drugs, which is brimonidine tetrate and temololumab, to utilize the complementary mechanism of action for a more effective reduction in IOP than either drug alone. This combination can be particularly beneficial for patients who require more aggressive management of their IOP or who are not adequately controlled on a single medication. That's all from me. Thank you.
Okay, now I will continue with drug E. The name of the drug is Zalacom eye drop. It contains latanoprost and timolol. The active ingredients contained in latanoprost is prostaglandin, while for timolol is adrenergic antagonist. The purpose of both drugs are to reduce intraocular pressure. Among the side effects of prostaglandin are iris color darkening, increased eyelid pigmentation, hypertrichosis, conjunctival hyperemia, allergy, cystoid macular edema (CME), anterior uveitis, and punctate corneal erosions. For the side effects of timolol, it divided into two. The first one is ocular side effect, and the second one is systemic side effects. For the ocular side effects, timolol gives less than other agents and cholinergic agonists. There is no significant miotic effect, none of pilocarpine-induced accommodative spasm, blepharoconjunctivitis, and corneal anesthesia. For the systemic side effects, timolol gives cardiovascular effects such as bradycardia, respiratory effects such as bronchospasm, central nervous system effects such as depression, and the last one, allergy and dermatological problems such as rashes. The administration for both drugs are the same, which is topical instillation or eye drops. The usual dosage for both drugs are once daily dosing, but for timolol, it only applicable for 0.25% and 0.5% solution. The goals of treatment for prostaglandin is to increase uveoscleral outflow by relaxing the ciliary body, while for timolol, or adrenergic antagonist is to decrease secretion of aqueous humor production by blocking beta receptors in the ciliary body. The other brand that available for prostaglandin are uniprostone isopropyl. The name of the brand is Rescula. And the second one is Travoprost. The name of the brand is Travotan. While for the other brand that available for adrenergic antagonists, levabunolol, betazolol, metipranolol, and the last one is cartaolol. That's all from me. I will pass to the next presenter. Thank you.
Next, I will continue on the drug Azopt with the active ingredient brinzolamide. The purpose of this drug is to lower the elevated intraocular pressure by reducing the aqueous humor as a result of inhibiting the carbonic anhydrase enzyme. It is usually administered topically, and the dosage is 1 drop to the affected eye and about 2 to 3 times daily. Common side effect includes blurry vision, bitter or unusual taste, dry eye, headache, eye discomfort, and foreign body sensation. In severe cases, there could be redness, pain, itching, and signs of allergic reaction, dizziness, and trouble in breathing, but it's usually less common. The primary goal of treatment is to reduce the intraocular pressure. Other brands are also available, such as Azarga, which is a combination of brinzolamide and timolol, and Simbrinza, which is a combination of brinzolamide and brimodidine tartrate.
Now I would like to talk about Pipril, which is the brand name for piperacillin bacillate ophthalmic solution that works as an antihistamine. The active ingredients for this brand is piperacillin bacillate, and it is an antihistamine that works by blocking histamine that causes allergic symptoms. This medication is used to treat itching of the eyes due to allergies. It is administered through eye drops. The patient need to apply topically on the affected eye twice a day, ideally on the morning or evening. If the patient wear contact lens, they need to avoid wearing the contact lens after the administration of the drugs. This piperacillin bacillate have some potential side effect, which is mild taste sensation, headache, eye irritation, and sore throat. Severe side effects are rare. The primary goals of the treatment is to relieve the allergic symptoms of allergic conjunctivitis, including itching, redness, swelling of the eyes, as well as to improve the patient's comfort and vision during allergy season or exposure to allergen. Based on my findings, there is one other brand names that have the same active ingredient as Pipril, which is Dalion. Next, we will continue with Vigamox moxifloxacin ophthalmic solutions, IP 0.5%. The active ingredient for this drug is moxifloxacin. Moxifloxacin is a drug that is categorized under anti-infective, antibacterial drug. Moxifloxacin is a drug that is used to treat infection of the eye, including bacterial conjunctivitis. Moxifloxacin works by killing the bacteria that causes the conjunctivitis. The administration for Vigamox is topical drop installation in solution formulation. The usual dosage for Vigamox for bacterial conjunctivitis for adults and children that is older than 4 months, the dosage should be 1 drop 2 or 3 times a day for 7 days. Meanwhile, the dosage for children under 4 months must be determined by the doctor. Since the moxifloxacin is one of the ocular antibiotic, The individual who is prescribed with moxifloxacin should use it until the prescription is finished, even if he or she feel better. If any individual stop using moxifloxacin eye drop too soon, the infection may not be completely cured and the bacteria may become resistant to antibiotics. If you miss a dose of this medicine, apply it as soon as possible. However, if it is almost time for your next dose, skip the missed dose and go back to your regular dosing schedule. The usage of moxifloxacin can cause several side effects. The more common side effects are red, irritated, and itchy eyes, blurred vision, eye pain, dry eyes, and discharge or excessive tearing. The aim of treatment with moxifloxacin is to improve the symptoms and to kill the bacteria that causes conjunctivitis. Other brand names for moxifloxacin other than Vigamox is Mozaxa. Mozaxa. That's all from me.
The next drug, it is antiviral agent, which is ganciclovir ophthalmic gel, which is manufactured by Zirgan. So the active ingredient is the ganciclovir itself, and the purpose of this antiviral agent is to treat acute herpetic keratitis. And the administration is the same as others, which is through topical drop installation, and the usual dosage is 1 drop 5 times a day until the cornea ulcer heals, and then we reduce it to 1 drop 3 times per day for at least 7 days. As for the side effects, a patient may experience blurred vision, eye irritation, conjunctival hyperemia, and also punctate keratitis. And the goals of this antiviral agent, ganciclovir, is to reduce symptoms of acute herpetic keratitis like pain, and also heal the cornea ulcer. And other brand that are found similar to Zirgan is the Virgan, which is also contain ganciclovir. That's all from me. Thank you.
Okay, lastly, for the tentative diagnosis, considering all of the drugs that take by the 70 years old patient, he might have first uveitis as he consumes tropicamide, prednisolone, and dexamethasone, and number 2 is glaucoma as he taking timolol, latanoprost, and brinzolamide. Then third one is inflammation as he used bapotestin and bromfenac to treat it. And number 4 is bacterial conjunctivitis that can be cured with moxifloxacin. And the last one is acute herpetic keratitis, which he is taking ganciclovir as a drug that used to treat viral infection. Okay, this is our reference for this case study, and that's all from us. Thank you.